Casualty 911, 10 a.m. to 11 a.m. with the consultant. Health is not merely the absence of diseases. It is your social, economic, physical, spiritual, and mental well-being. Just imagine you on 88.5 Soufriere FM talking, questioning, sharing your experience, information, education, entertainment, news, instructions, advice on diabetes, high blood pressure, strokes, menopause, AIDS, pregnancy, sex.
Sex? Did you say sex?
As prescribed, take your medication, exercise, and diet. On 88.5 Soufriere FM, tell a friend, call your neighbor. Casualty 911 is on.
Good morning. Good morning to our listeners of Casualty 911. Welcome back to our regular listeners and welcome to our new listeners. We've had such a long break the whole of December, I think, and now we're in the second week of January. So I feel like we need to reintroduce ourselves. My name is Fawn Minviel. I work with the Bureau of Health Education in the Ministry of Health, Wellness, and Elderly Affairs. And with me is my colleague.
Hey, Fawn, I thought you would introduce me.
Wilson, who also works with the Bureau of Health Education in the same ministry. I work in Region 5, Health Region 5, which is Beaufort, Labrie, Saltibus, and Miss Wilson is here on the other end in Region 6, Choiseul, Soufriere, and Canaries. So we've had this program going on for quite some time, and as you know, it is, for those of you who listen regularly, it's a health program. So we talk about different aspects of health. I hope everybody had a wonderful Christmas. And as we say, by now in the second week of January, everybody should be done with all the Kwas Noel. So all the rest of the ham and the rest of the drinks and the rest of the everything that you have consumed or put away. And now we are ready to think very seriously about health again. Miss Wilson, I know you always like to have a special welcome and hello to different people around. So you go ahead and do that, and then we will move on to our topic of the day.
So let me just say good morning to all our listeners. It's always a privilege to be here to speak on different health topics. This year, we're hoping that persons will call in on our program a little bit more and give us a little bit more feedback so that we can really improve on our program. Tell us a bit about what you really want to hear about topics. It don't have to be for you. It could be for a friend, a concern you have. We'll be happy to assist you or bring someone in that could really speak on the topic. We'd just like to say good morning to our friends at M&C Drugstore, at Odell, the market vendors, our council workers, and our listeners in Canaries, Choiseul, our bus drivers, and persons at Hotel Chocolat. Good morning to you. It's always a pleasure to be on the program, and we're hoping that throughout the year, whilst you listen to the program, you can really make a good decision as it relates to your health. It's just not about listening to our program, but the fact that we bring across certain information to you as it relates to you. Are you willing to make that change? And that's what our program is all about. We provide the information to you. We tell you where the services are available. You realize you have that health issue. Are you willing to act on it? And this is a question we want you to ask yourself. Are you willing to change your lifestyle and to ensure that you are a healthier person, provide for your family a healthier family, and by extension a healthier community? We don't want to come out there at the radio program giving you all that information and it doesn't make a difference. That is why we're here. And we're hoping that this year, like Fawn said, is the beginning of the new year. As part of your New Year's resolution, your goals, face the challenges that you want to, but health wise, make an informed decision that you want to take better care of yourself. And that is one of the reasons we're hoping that persons, and hello, like we said, the services at the wellness centers are, most of them are free of charge, and you have it right there in your community. Let's take advantage of that, that opportunity, because many people don't have that opportunity, and you have it right there at your doorsteps. And we're hoping that you can make a change. Another thing I want to make mention of is your medication compliance for the new year. Yes, you have that health issue. You're given the medication, but do you take the medication the way you're supposed to? And that's one of the things that is really a problem in our community, because more and more you see persons having a stronger dose of that same medication, or they end up having more health complications. Speak to your doctors. Don't be afraid of our health professionals. Speak to them, be honest, take your time, have a conversation with the health professionals. If you have questions, you have queries, you unsure of something, take your time, ask, and learn. All right. So, having said that, I will pass you on to Fawn. Fawn, go ahead and tell us about the wonderful topic we have today for all our listeners.
Okay, so this morning we will be talking about cervical cancer. We were supposed to have a guest. Unfortunately, she's unable to join us this morning on this slot. Our topic this morning is cervical cancer, and Louisa and I will be taking you through some important elements of cervical cancer, what it is, how to prevent, early detection, the signs and the symptoms, and the importance of being proactive, as Louisa said. So we are going to start off. This month, January, is Cervical Cancer Awareness Month. And if I say cervix, then I think most of us, if not all of us, would know that the topic is geared towards women. But as we always say, no matter whether whoever is affected by a condition, everybody else around them is affected. So, in as much as only women can get cervical cancer because only women have a cervix, the men in their lives, the children in their lives, the rest of the family and friends are affected if they become ill with cervical cancer, because there are repercussions. It's like a ripple effect, we say, emotionally, financially. So we have to bear that in mind. And when you listen, if you listen, maybe not only for yourself, but for your family members, your friends, to encourage them to do what is necessary to be proactive in terms of taking care of their health. Cervical cancer is considered to be one of the most preventable. So when we talk about the cervix, and I said only women, what does that mean? It means that it affects a part of the body called the cervix, which is part of the female reproductive system. So it's the neck of the womb, as we say, the neck of the womb. So si ou pa ni ma twist, ou pa sa ni cervical cancer. So se fam ki ka ni ma twist se gwa moun nan kay kompon sa bien, ma sa pou se jenes la. But that is where the child is carried. That is where you grow the young ones within the female body. And the neck of that part between the opening of the uterus and the vagina, long ago, I don't know for you, but long ago I used to think the vagina was on the outside. But I learned as I grew up that the vagina is actually on the inside. So it's a canal on the inside. So at the top of the vagina, between the vagina, the end of the vagina, and the uterus is where we have the cervix. So that is where we have the neck of the womb, or the cervix. And we know that cancer is the growth of abnormal cells in an area. So we say that the multiplication, they just multiply. Those abnormal cells that go rogue, that want to do what they want, that they don't behave in a normal way, and they form a tumor. That is what a cancer is, and if it affects the cervix, then we call it a cervical cancer. So that is what we're talking about today. In terms of risk factors, I think I'll pass that on to Miss Wilson.
Not me, phone.
So some of the risk factors
Oh,
are, early onset of having sexual activity. And I will look at the risk factors in terms of the cause. Usually when we speak about cancer, we don't talk about a cause. We talk about multiple risk factors. Now, as it relates to cervical cancer, the research suggests that 95% of cervical cancers, about 95% of cervical cancers, are a result of being infected by a certain type of virus. And that virus is called the human papilloma virus. Now, when we talk about the human papilloma virus, we're not speaking about one single virus. So it's like a family of viruses. There are several different viruses in that group that we call human papilloma virus. And they have names, so they are numbered. Usually for these, they've numbered, and there are certain viruses within that family that are high risk for cervical cancer. That the infection by that particular one or two would put you at higher risk for cervical cancer. So that is the main risk factor, is that exposure and infection by the human papilloma virus. But there are other risk factors that we can take into consideration. And Miss Wilson, you ready?
no, I'm not.
I don't know what's wrong with Miss Wilson this morning. Miss Wilson just wants to give me a little trouble there this morning.
You know?
Okay, so in addition to that, we can talk about multiple sexual partners.
Mhm.
And you can imagine that if you have multiple sexual partners, then it would mean that the risk of exposure to human papilloma virus would be a bit higher, because it's a virus that can affect, that men or women can carry. Usually, human papilloma virus, you get it, you may get infected, and it goes away, and you never know. But there are certain ones among them, and certain times when the infection is there, and it can lead to that change in the cells of the cervix that would become eventually a cervical cancer. Now, in terms of the speed of development, there are other risk factors, smoking being one of them. And we could also mention, now, usually when you talk about contraceptives and maybe the risk associated, I always like to remind people that there's a reason why you take your contraceptives. And the fact that you mention something as a risk factor does not mean that definitely you will get the disease. So that is one of them. So the human papilloma virus being the most,
Mhm.
the highest risk factor for cervical cancer. It's, as we said, it's usually sexually transmitted, and it can affect various parts of the body. But today we are talking about cervical cancer, so we will focus on that. Yeah. The risk of the cancer developing, usually that cancer, it develops slowly, but that does not mean that it will develop slowly in everybody, because every individual is different, and there are other factors that could cause the disease to progress a lot quicker. So, for example, if somebody is infected with HIV, the cancer is likely to develop much more rapidly. If somebody is a smoker, so all of these things we need to bear in mind. Now, when we talk about cancers, I know usually people get uncomfortable, some people get scared. I've been having a lot of conversations with women about cervical cancer this month. And one of the things that comes up very frequently is, I don't want to know. I don't want to know. A couple of people have said to me, Miss, you're there and you're good, and then the doctor's just finding things. They cannot find what is not there.
So true.
Okay? They cannot find what is not there, and it is always better, particularly as it relates to cervical cancer, to detect early. It's better to detect early. When and we have services available that can put you in a position to detect changes very early. And those changes can be detected even before it develops into an actual cancer. So those services allow the detection of changes in the cells of the cervix so that you can be put on treatment and monitored, so that you don't find yourself in a situation where you have a cancer that has gone to a late stage and would require some invasive sort of treatment. So we're talking about being proactive, and you can be proactive. When it comes to cervical cancer, it is so very simple, right, Miss Wilson? Very, very simple. What is available? What is that service that is available and available free of charge at all health centers around the island? That women should not be dying of cervical cancer in St. Lucia, unless it should be so very rare for a woman to die of cervical cancer. Why? Because that service is free. We have people who are well trained and capable of delivering the service. And that service is what we call, and I'm sure a lot of you ladies know what it is, it's called a pap smear. It's called a pap smear. So, in terms of early detection, that is what's available to the ladies. And for those, we'll talk a little bit more about that. But before we go on to that, let's talk about the vaccine, the HPV vaccine that is given at the primary schools. That vaccine is meant to provide some sort of protection from the high risk HPV virus, the high risk HPV that could later cause cancer upon exposure. Okay, so in grade 6, the children are offered the HPV vaccine, and that is a preventative measure for cervical cancer along with others. But we'll not delve too much into that today because our focus is cervical cancer. Maybe at a later date,
Mhm.
if there is an interest, we can speak in detail about the HPV vaccine.
So, for not to cut you short, currently our nurses in our region, in the Choiseul Soufriere region, they're currently providing that service to the grade sixes at the various schools. So we're asking parents if they have concerns and any issues. Don't forget, our nurses are available to provide them with any information that they might need, so that our children can get the consent to get the HPV vaccine. Yeah.
And we know there's a lot of information out there, sometimes misinformation. Always remember to check credible sources when it comes to, if you have some concerns, you have some questions, you have some doubts, always ask people who are involved in that area. Check credible sites. You have the WHO, you have CDC. Check, read research papers. Not don't depend solely on a voice note going around, or
Mm-hmm.
a video of somebody claiming something and you know nothing about the person. Sometimes the person is claiming to be a doctor or nurse, and that person is not trained, is no doctor, is no nurse. So we have to be very careful in terms of where we get our information from, the information that would help us to make good decisions, really, as it relates to our health and the health of our children. So let's move on to the pap smear. Let's talk a bit about the pap smear. So the pap smear is offered at all the health centers, as I said, and all health centers have a specific date. Sometimes it's scheduled under cancer screening, but I know that many people refer to it as the pap smear day. Okay, so you can always call your nearest health center, or any health center for that matter. If you choose to go to a private facility, that is fine. The most important thing is that you get it done.
Or sometimes, depending on your work schedule, sometimes our nurses can accommodate you on less busy days for them, and they'll give you a date and time to come in. Yeah.
Exactly. So our nurses are always willing to accommodate you, for those of you who may not be able to make it on the specific day. But it all comes down to conversation. So you call, you have a conversation, you ask and you shall receive.
Yeah, for true.
All right. So in terms of the pap smear is a fairly simple procedure that is done in the health centers by our nurse midwives. Those and what it is that you go in. Would you like to describe the procedure,
Fun. The
Rita?
procedure, not me at all. Let me just say this. Different people have different experiences as it relates to the pap smear. I think Fun would be a better position to explain
Really?
the pap smear for you. But all in all, I think our nurses do try their best to make persons comfortable. And some people come in, based on what they have actually heard from other people. But you have to come in with an open mind, stay relaxed, stay focused, and continue the conversation with the nurse whilst the procedure is being done, because they'll keep you engaged to keep your mind off of things and so on. So, Fun, go ahead, explain that procedure.
Okay, so since Miss Wilson spoke a little bit about basically your mental preparation, let's talk about other things that we do to prepare for a pap smear. Many people think that they need to do so much. They need to shave. They need to. You're not going to have a baby. You don't need to shave. You can go the way you are comfortable. If you're comfortable, if you don't usually shave, then you don't shave. There's no need for you to use any vaginal wash or douche to
Mm-hmm.
try to clean out or make that area smell like roses. It's not meant to smell like roses. Okay? And the other thing is that you should try to refrain from having sexual intercourse for between 24 to 48 hours prior to. So before you go for your pap smear, you would not, on the day you're going for a pap smear, you take a little quickie, fast, 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 fast. No,
Mm-hmm.
because we don't want anything to interfere or to be left behind that could you know,
So it can give you an inaccurate
to
test result.
inconclusive test
Mm-hmm.
result, a test result that is not true and accurate. So basically, I think that's it. Is there anything else we need to do in terms of preparation for the pap smear?
Um, no, I think we've spoken about the mental and so on.
Oh, and the other thing is, by all means, I mean, it may seem obvious to some, but it may not be as obvious to others. If you are menstruating, if you're on your period and you're bleeding, that is not a good time to go for a pap smear. You need to go when you are not bleeding. Okay?
Oh yeah.
In as much as we want it to everything to be comfortable for you, it has to be comfortable for the nurse. And you can imagine if you're bleeding, they may not be able to get a proper sample. So these are the reasons, some of the reasons why we urge people to just pick a day when you are not menstruating. Plan ahead so that you don't have sex on the day of or the day before, the night before.
Discuss it with your partner too.
Discuss it with your partner, okay,
Mm-hmm.
so that you can go in and get your pap smear done. So the pap smear is a very short procedure where the nurse would use uh oh my gosh, the name of the instrument just escaped me, but they have
Uh,
to insert
why did you say
something
that? So it escaped
and
me
they
too.
open it up a little. Maybe that is when you might feel a discomfort. Like a lady said to me, you must expect the thing will be uncomfortable. C'est pas veine qui là, c'est pas veine. So when we say veine, I think you know what we're talking about. So it's a foreign object going in there, and then they would use a swab to try to get a sample from the cervix, and then they would put it on a slide to be taken to the lab, to prepare it on the slide to be taken to the lab. And thankfully, in the public health system, we know that when you go for your pap smear, usually the nurse will also do a clinical breast exam, which is something that we women need to have done once a year anyway. So you would basically be killing two birds with one stone. Now, one of the barriers in terms of people not going to get their pap smear is that one, people talk about it being painful, and one, as Miss Wilson said, as Louisa said to you, it takes a lot of mental preparation. Also, we know our healthcare professionals, they try to be as efficient and as making the procedure as comfortable as possible for you, but you need to be relaxed, open-minded, know what to expect. So the fact that you are expecting that something, the name of that thing is just not coming to my mind right now.
Fun, what is that, sir?
The instrument that they put into the vaginal canal, the vagina.
Let me think. Let me think.
So you know that you're expecting an instrument to go in there. So all of that is preparation so that it will be more comfortable for you. Let's say less uncomfortable for you to have that done, and you get your results. One of the downsides that many people mention in terms of the public system is that you know sometimes it takes a while to get your results back from the lab. So there are other options that you can discuss with your nurse in terms of getting your result a little quicker for a small fee. So all of these things you can discuss with your nurse if you decide to go to the health center to get your pap smear done. And in preparation for this for today, I
The
was reading a little
speculum.
bit the speculum, right? Thank you, Louisa. So that is the instrument that is inserted into the vagina and kind of opened up a little bit.
And
The
then you
nurse
actually hear the nurse.
can examine the cervix and check how healthy you look, because there's a certain color that it's supposed to look. It's supposed to look a certain way, and just from a visual examination, the nurse can see certain things. But then the swab would allow them to check for to see if you have any changes in the cervix that are worrisome. Okay, so I was saying that in some countries, the pap smear has evolved to such an extent that women are actually taking the sample themselves.
Really?
Yes,
I knew
so
that.
there's a home service. You do it yourself. We have not come to that stage, and I don't think I am prepared for that.
I'm not
But
prepared.
but just it's just to show how, I guess, basically simple that it can be. How simple it can be that some women are now doing it on their own at home, taking the sample on their own to be sent to the lab. So please make use of the service. We have trained professionals. Make use of the service. Now there's some questions and topics that come up quite often when we talk about cervical cancer. So we will try to speak about some of them. And one of the things that comes up is that people will say, I don't have a partner, I have not been sexually active for a little while. Should I go in and have a pap smear? My answer would be yes, in that just generally it would be a yes. Why? Because there are other factors that have not been indicated. We don't know when was the last time the person had a pap smear, what the result was like. We don't know what the lifestyle is, apart from the person saying that they have not been sexually active for a couple of years. So yes, it's important to go in and have the pap smear. And while you are there, we always talk about, Louisa and I always talk about the importance of having a relationship with your healthcare provider to be able to discuss openly all your concerns. So thereafter, you can determine with the help of your health provider whether you should come in the next year. Because in St. Lucia, we encourage women to come annually, so to come in every year to have their pap smear done. And in some countries, the screening is offered every other year or every 3 years, every
Mm-hmm.
5 years, dependent on age and so on. But here we encourage women every year. We know that even though we encourage women every year, there are some of us, we might still skip a year or two. So can you imagine if we asked women to come in every 5 years? Number one, we might lose track of the 5 years because there's nothing in place to serve as a reminder. And then that gives an opportunity for the development of any abnormalities if there has been some change over the years that you have not gone into the pap smear. So let us try, and of course you can always have a discussion with your healthcare provider, whether it is your private doctor
Mm-hmm.
or in the public health system, to discuss what is best for you. In terms of people who say, I've had a hysterectomy and should I go in? We we don't know whether the hysterectomy is a partial hysterectomy, a full hysterectomy, if the cervix was left in. But there are other things that there are other conditions and other changes that the health professionals look for when they do an examination of the pelvic area. So you may want to go in and have that discussion on an individual basis with the nurse or your doctor.
Fun. Having said that, I know we're speaking about cervical cancer, but a lot of women who have had a complete hysterectomy, they completely forget about their breasts also. You understand? So we're encouraging women to still, even if you have had a complete hysterectomy, don't forget your breast. Do your monthly examination or come in, have the nurse take a look at your breast because they've had persons who forget about their breast because they've had a total hysterectomy and they feel there is no need, and then they have developed breast cancer. So we're also encouraging persons to come in. I mean, even if you have had a total hysterectomy, um, our nurse can still do the breast examination for you and so on. You don't have to be every year, but you can do your self breast examination and observe your breast throughout the years. And often on come to our wellness centers, let the nurse take a look and so on, or your private doctor, if you so desire. Yeah, Evan?
Okay.
Yeah.
So now that we have spoken about the pap smear, we have spoken about some of the barriers, and we looked at some of the frequently asked questions, the things that come up. I think it's important for those of us, sometimes you go out there and we ask, and you're doing the awareness, you're having conversations with
Mm-hmm.
women about cervical cancer and the pap smear and the importance of it and so on. And very often we would ask, so did you have your pap smear last year? When did you last have a pap smear?
Since after my last
Eh,
child.
Me, I haven't done that since after my last child. And how old is your child? Me say, ha, go on, or he's already 10. So if you have to think so far back, you know that you are well overdue. He had poor Vinny. So this year, this month, make that decision to come in, to go in and get your pap smear done. If you have to think so hard, if the last time you had your pap smear was when you just had your child, and the child is already 2021 and they give you grandchild already, you know you have waited too long. So you need to go in as a matter of urgency. Be proactive. Be
Mm-hmm.
proactive. Go in and get the pap smear done. We all know that getting diagnosed with late stage cancer takes a toll
Yeah.
on us. It doesn't even have to be late stage. By the time we hear cancer, it takes a toll on us emotionally, and
Mm-hmm.
it takes a toll on the rest of the family and the friends and the community. And financially, it is a, a weight on your shoulders. And in this case, we are saying to you that very likely it can be avoided because it can be detected so early. So we need to try to be present. When I say present, think about ourselves in the present moment. What can we do apart from all the things that we know we have to do? We have to do our medical checkup once a year. Include that one in it. For the women out there, for those of us who have been slacking, I always include myself. I always include myself. So
Yeah, some
for
of us
those
are
of us
guilty.
who have been slacking off and we have not been proactive and we have not gone in, let us make the time.
So for what about women that go through menopause? I know a lot of women that has already gone through menopause, they don't see the need for
And
such
I think
anymore.
you can respond to that very well, Miss Wilson. For those of us who have, And since she mentioned menopause, I realized that we did not speak about the signs and the symptoms.
Yes.
The
Um,
signs and the symptoms.
so that is one of the things that just came to mind whilst listening to phone. Today I'm taking the back burner. um Many times women go through menopause, and then they no longer have a partner in their lives. And don't forget, Fawn said about there are other factors that contribute, risk factors that contribute to cervical cancer. And these are one of the things I
And not
want.
just to cut you shorter, not that they just don't have a partner in their life. Sometimes they have a partner. When you pass a petty mama yako. You
or
pan
or
poor
they longer
about
have any sexual intercourse.
mind you. They feel because they can get pregnant again.
That is true.
Menopause hit. They have nothing to worry about. That's for those with the partners, eh?
So, you still have to come in to do your thing. I think it's up to the age of, what age do we do? 70, 65.
I'm
It's
not too sure of the age.
debatable.
It's debatable, about 70 years, but that
Yeah.
is something you would discuss with your healthcare provider, with the nurse or your doctor.
And so women that age, don't forget to come in and to come in to do your pap smear. Throughout the years, I must admit, we're seeing the 40s, the 50s, but I'm not really seeing the 60s coming into our wellness centers to do the pap smear. So I'm encouraging you at that age to come in, speak to the nurse. Sometimes you have not done a pap smear for a number of years, like Fawn said.
So it could have
And
been 20 years ago when you were in your
yes,
40s.
and so on. So these are things you have to be thinking about, and you know make a decision for this new year to come in. And one of the symptoms, signs and symptoms, as Fawn said, is bleeding after menopause. Now that we mentioned menopause, so that's one of the signs and symptoms. About, is our time up? No. Okay. And so women, so you have pain during sexual intercourse. If that's a very common thing for you, that is a cause for concern. That doesn't mean all women that have pain during sexual intercourse, you um you know but however, if that is, you need to seek medical attention. The other thing is blood spots or light bleeding between or following periods. So these are some of the signs and symptoms of cervical cancer. What else? Oh, increased vaginal discharge
And a foul smelling discharge.
and a foul smell discharge. So you have to come in, speak to your nurse or your private gynae or your gynecologist, whichever one you feel comfortable with, and then you can take it from there.
Now you also need to take into consideration that you may be affected with cervical cancer and there may not be such obvious signs and symptoms,
Mm-hmm.
particularly in the early stages. So that is why the pap smear is so important. But as Louisa said, these are some of the signs and symptoms. Now, in the very same way that when we talk about risk factors, it does not mean because you have a few risk factors you are going to get the condition. If you have those signs and symptoms, it does not mean that you have cancer. You can only know if you have cancer when it's tested, when you are tested and you are diagnosed. It does not mean that you have cancer. It could be another condition, but as she said, these are signs that should be worrisome, that
Mm-hmm.
should push you to go and seek medical attention so that you can find out what is wrong with you. Don't stay at home and wait and see and pretend. If you already know that you have a condition, so for example, with the fibroids, We had that topic last year. We spoke at length. We had a doctor in who spoke about fibroids. So, for example, with the fibroids, you may know that you may have some bleeding in
Bleeding.
between the periods. You're already diagnosed, you're already being treated for it. You may not necessarily take it as, especially if you're having your pap smears done regularly, then you know that you would not necessarily make that association. You would not link it to that sort of thing. But it is always best to go in and have some kind of medical intervention. Go and talk to the doctor, go and talk to the nurse. Pawete homework di my wesa, and my friend over there told me to drink that, so I'll drink that, and oh, it didn't stop. So my coworker told me she had the same thing and she used that, and we like to do that in Sinusha. We love it. Tout tout we medyo ba no ka try li avan no IoT doctor. I'm not dissing our local medicine, our bush medicine, but I'm saying to you, if you have tried one thing and it didn't work, at least go and check the doctor.
Let him tell you what
Let the
you.
doctor check you out, examine you, send you for some tests, see what's happening. Instead of trying to treat yourself over and over and over, and then when you decide an IoT doctor at that point,
It's too late.
it may be too late.
Yeah.
Okay. So Louisa, I think we can wrap up now, and I know you always like to speak with our listeners.
Really?
Yes, you like to speak
For
to our
just
listeners, so I'll let you do the wrap up.
Fun pull a fast one on me, because she has been doing most of the talking.
You listen how she spoke at the beginning. Yeah, so she's going to do a wonderful little wrap up for us, and
Yeah.
to encourage you and to tell you whether services are available and so on. Thank you so much, Louisa. I appreciate
You're
it.
very welcome. So let me just say, thank you, Fawn, for providing all that information. And like we said, the information is just is out there. We bring it there to you, so that you can act on it. It's true, sometimes women go to our wellness centers and they say the results take so long. However, at the end of the day, you still get your results. And based on the results, you're able to act on it. Something I want to say to all our listeners: after you've gotten your results, whether if it's not good or they send you for further testing, do not be afraid. Use that guidance to go out there, do further testing, and see what is really happening to your body. Sometimes it's nothing too alarming. Sometimes it's something that you can get early treatment for. Some people tend to be in denial when they tell them, they're seeing little signs, and then one time they kind of block it off their mind and they start living their life in a different way. They tend not to cope with it very well. So we're asking persons, there are other services available that can help you deal with these things. It's like I go to the doctor and I did my pap smear and they say, Miss Wilson, we're seeing um something, and therefore we want to send you for further testing. And one time, and they're like, one life to live, and I'm just living my life like there is no tomorrow. No. Sometimes it can be a simple thing that can be treated with just simple antibiotics, or a change in your lifestyle, what you eat, what you drink, and they ask you to, focus on other things. Maybe it's your level of stress. So many things can be contributing factors. And that is what we are there for, to assist you at our wellness centers, and the services are available. I just want to mention that it's true. One of the things that I find, people, when they come to our wellness centers, they do not want to wait. And I want you to put yourself in that situation. When you come to seek medical attention or you come for that service, wouldn't you want to have an open discussion with your nurse to hear your concerns, or the doctor to hear your concerns, and so on? So by having a little discussion, they might take more time with one patient than the other. And we want persons to understand these things, or other persons might have other complications. So in coming to further services, bear some patience, because at the end of the day, you want the doctors to perform their best at what they do. So you out there waiting for that service, quarreling, making noise, distracting the person inside is not the best. And I want persons to understand that, because these are one of the things that I observe. If you know you're coming to seek medical attention, you ask for your time off, or you know you have half the day. During that time, you know that is the time allotted. If you know you're coming to work, you're going to work for 2 o'clock, do not come to the wellness center at 1 o'clock and expect that you will get the service right away, especially on a busy day, because you do not know when it will be busy or when it is a light day for nurse or doctor. So I want you to bear that in mind. I know some communities we do not have that problem, but some communities I think it's becoming more and more of a problem. People need to understand these things. To get the best service, you have to exercise some patience and so on. Another thing is, if you come for the services that are available, it's your approach to the health professionals sometimes makes a big difference. And we want persons to understand that you don't come with that same mentality, coming and quarrel. You just enter and you're already quarreling. I mean, that disrupts the entire system, the entire everything that goes on at that clinic. Having said that, we women need to understand. Sometimes they say men are more reluctant to come and seek medical services at our wellness centers. But some women, we hardly see them at our wellness centers, or they're even more afraid of the doctors than some men. So that small percentage, we were encouraging you this year to come in, do your pap smear, come and do your pap smear, get your breast exam, or whatever um, medical service that you might need. And there are many services at Soufriere Hospital and our wellness centers. They have dermatology, podiatrists, they have dental at Soufriere Hospital, which of there is an internist coming at our wellness centers, yes, at specific days. So ask the nurses at our wellness centers which services that might apply to you, and they might guide you. All right, it might not be every week, but it can be once a month that many of these services are being offered. So again, we're looking forward to seeing all our women that has not done their pap smear for a very long time to come into our wellness centers and to get that service done at our wellness centers. And don't be afraid if your schedule does not correspond with the days that they're offering the pap smear. You can always speak to the nurse, and our nurses will try to accommodate you as much as possible. And they welcome that opportunity, because a lot of nurses welcome that opportunity to do the pap smear for our community members. All right, Fawn?
So thank you very much. Just to end, I would like to say thank you to all of those who joined us on Facebook and on the YouTube channel. I see here on Facebook Miss Ian P. Emmanuel watching from Brooklyn. Thank you for joining us. And Natasha Jean, who said hello to Miss Wilson earlier. So thank you very much.
Hi, Natasha.
We look forward to your questions, your comments, and your input as we continue with our programming this year. Thank you so much.
And thank you, Romanas.
Yes, Rome. Thanks for hanging around.
Oh, and Erlan, we miss you, by the way.